Masturbation, solo sex, self-pleasure, self-love. One of the most common human behaviors and also one of the most misunderstood. Some people feel it's harmless. Some people feel it's secretly destroying their performance in bed. And many people live in the middle doing it but carrying worry, guilt, or confusion. So today, let's talk like adults, not with shame, not with fear, and definitely not with myths. I am Dr. Ahmed Arslan. I am a urologist and sexual health expert. And in this video, I'm going to explain what masturbation can do for your body and mind, what it cannot do, when it becomes a problem, and the truth behind the most common myths I hear in clinic. And yes, we'll talk about erections, sensitivity, testosterone, and porn clearly and medically. So if you ever wondered, am I damaging myself or is this normal? Stay with me because this video might remove years of unnecessary stress. First, you are not strange for having these questions. A large population surveys consistently show that masturbation is common, more common in men than women, and patterns vary by age and culture. For example, a survey found that about 3 in 4 men and about 4 in 10 women aged 16 to 44 reported masturbating in the past months. So the real question is not do people do it? The real question is how does it affect you? Let's talk about the benefits. Number one is mood, stress, and sleep. Many people report feeling calmer after orgasm, and that's not imagination. Sexual stimulation and orgasm can involve changes in brain chemicals linked to mood and relaxation, like dopamine and endorphins. That's why some people notice reduced stress, better sleep, and a short term mood lift. Number two, it can help you learn your body. Here is something I say very openly. If you don't understand what helps you feel aroused, how will you communicate it to a partner? For many people, masturbation is a way to learn what you like, what pace feels comfortable, and what doesn't work. That knowledge can improve communication and confidence. Number three, it's safer than risky sex. For a medical point of view, masturbation is one of the safest sexual activities. No risk of pregnancy and essentially no risk of STIs when done privately and hygienically. So yes, it can be part of a healthy sexual life. But here is the important part. Healthy depends on how it's used and what it's doing to your mind. The myth number one is masturbation makes you go blind or cause hairy palms. Let's be clear. That is not medical science. That is fear-based folklore. Major medical sources explicitly list these as myths, not real outcomes. Masturbation does not cause blindness, hairy palms, penis shrinkage, infertility, or permanent weakness. So, if you have carried these fears since childhood, you can release them. Myth number two is masturbation causes erectile dysfunction. That's one of the most common message I get. Doctor, I masturbate. Am I ruining my erections? In most cases, no. Erectile dysfunction is usually driven by things like blood vessels health, nerve functions, hormones, medications, anxiety, relationship stress, sleep deprivation, smoking, diabetes, and cardiovascular risk. Masturbation itself is not proven to cause erectile dysfunction, and reputable medical sources list ED from masturbation as a myth. But there are two important exceptions that people confuse with masturbation. Exception A is performance anxiety. Some men can get erections alone but struggle with a partner. That often points to anxiety, not damage, because anxiety triggers stress hormones and stress hormones fight erections. So, ironically, if a man can have normal erections during masturbation, that can be reassuring. It suggests the physical system can work. Exception B, porn driven conditions, not always but possible. This is where people mix up the story. Some research and clinical experts propose that heavy repetitive internet pornography use may contribute to sexual difficulties in some men. through desensitization, unrealistic expectations, and anxiety loops. But the evidence is not simple and not every study agrees. Some findings are mixed, and for some people, porn does not cause dysfunction. So, the honest medical answer is this: porn may be a factor for some, especially with very frequent use, escalating novelty, difficulty becoming aroused without it, or anxiety during real intimacy. In clinic, what matters is not judgment. What matters is your pattern and your symptoms. Myth number three: masturbation reduces sensitivity and makes orgasm harder. This one is partially misunderstood. Masturbation does not destroy nerves, but the body does learn patterns. If someone always uses very high pressure, very fast stimulation, or a very specific technique, the brain can get used to that exact style. The partnered sex, which often feels different, might not match the same intensity. So, what's the practical, healthy approach? Avoid excessive force or friction, vary technique and pace, and if you use devices, don't rely on the high intensity every time. This is not about fear, this is about training your arousal system to be flexible. Myth number four is you cannot masturbate daily, it's always too much. Frequency alone is not the best measure. For many adults, daily masturbation is not automatically harmful. The real question is it interfering with your life? It becomes a problem when you feel compulsive and distressed. You skip responsibilities, you avoid your partner repeatedly, or it becomes the only way you can regulate stress. Think of it like food. Eating daily is normal, but binge eating to escape emotions becomes a different issue. So don't judge by frequency alone, judge by function and control. Myth number five: if you masturbate, your relationship must be bad. No, many people in healthy relationships still masturbate. Sometimes it's for stress relief, sleep, personal preference, or different desire levels. It does not automatically mean lack of love, lack of attraction, or betrayal. But if masturbation is replacing intimacy and your partner feels rejected, then the issue is not masturbation. The issue is communication. And communications can be fixed if both sides are willing. Myth number six: masturbation lowers testosterone. This myth spreads like wildfire online. Here is what the science suggests. There is no good evidence that masturbation causes a long term drop in testosterone. Some studies show no meaningful short term change, and hormonal responses are complex. So, if someone tells you your testosterone is falling because you masturbate, be skeptical. If you have symptoms of low testosterone, fatigue, low libido, low energy, mood changes, that deserves proper medical evaluation, not internet blame. When should you worry? Now let's talk honestly about red flags. Masturbation may be worth rethinking if you feel out of control, you try to stop and can't, and it causes distress. You feel persistent guilt or shame, especially if it affects mood, anxiety, or confidence. If your beliefs conflict with your behavior, it can create real psychological harm. You need porn to function sexually. You struggle with arousal without it, or partner intimacy feels flat. You develop pain, irritation, or injury, friction, rash, or soreness should not be ignored. In this situation, the best step is not self punishment. The best step is adjust habits, reduce triggers, and if needed, talk to a doctor or a qualified therapist. Because your sexual health is part of your overall health. Here is a simple, medical, non judgmental way to think about it. Masturbation is usually healthy when it does not harm your body, does not control your life, does not increase anxiety, and do not replace intimacy in a way that creates relationship damage. If it's helping you sleep, relax, and understand your body, it's fine. If it is becoming an escape that increases guilt, isolation, or performance anxiety, then adjust the patterns. So let me end with this. Your body is not your enemy. Your sexuality is not something to fear. What harms people is not masturbation itself. It's misinformation, shame, and anxiety. I am Dr. Ahmed Arslan, and my goal on this channel is to give you clear, evidence based guidance without judgment. If you found this helpful, subscribe because we will cover erections, desire, testosterone, pelvic health, and relationship psychology in a medical and respected way. And remember, take care of yourself because you are worth it.